All right. So we have been talking about the structure of the brain and all the different components to it and what they all do. So flushed out there. There it goes. So hopefully by now you've been practicing all these different parts of the brain because part of the reason, remember I told you you need to know this is because now we're going to talk about how things can go wrong or what happens when things go wrong in the brain. And it doesn't make any sense when you start talking about these different neurological conditions and mental health conditions if we're talking about like what affects like the frontal lobe or the temporal lobe if you don't know what those words mean. So as always, keep practicing your different parts of the brain so that we can keep doing better as we progress through this unit. We are almost at the end of this unit. So today we're going to talk about the different neurological disorders and mental health conditions. So we're going to look at the differences in the brain, why we understand them, how we understand these differences, what treatments are available for certain conditions, things like that. Before we get started, again, make sure you have like your guided notes with you. But before we get started, so just keep this in mind. First and foremost, I am not an expert in all things mental health or neurological disorder. Okay, I'm not a medical doctor, I'm not a psychiatrist, not a psychologist. I do find psychology and the study of the brain very interesting. That's why I used to study the brain in the research lab. So that just being said, this information is for learning. Okay, it is not to diagnose yourself or anyone you know. If any of the things we talk about seem to resonate with you or anything like that, like on a personal level, not just hey they're interesting, you got to talk to an actual medical professional. Not, I'm happy to point you in the right direction, but I'm not a medical professional, y'all. So and again, don't trust anything advice you see on TikTok. It's TikTok. Anybody can make a video. It's probably wrong. All right. And also, if you really do like this kind of topic, if it leaves you curious for more information, consider taking psychology, whether it's in high school or college or both. I took a lot of psychology classes in high school and in college, and I loved them. They're fascinating to me. So let's get into it. Make my computer work. Okay. So quick review. Remember, we know the brain. We talk about the different parts. All right. As a kind of just a collective in terms of organs, it uses a lot of energy. All right. Primarily, specifically, it runs off of a molecule called glucose. That is your blood sugar. So if you ever hear, like, if you know somebody who may be hypoglycemic or type 2 or type 1 diabetic, they may talk about something like their glucose levels. Okay, so that is the sugar, the form of sugar that is in your blood that helps give energy to all your body. Okay. Fun tip, if it ever ends in OSE, OS, that means it's a type of sugar. So like lactose is milk sugar, sucrose is table sugar, like what you put in your coffee. There's galactose, fructose is fruit sugar. There's all kinds of sugars out there. So you eat the food, eat your lunch, eat your breakfast, it turns into glucose. Body parts, specifically like in this case the brain, use that to produce ATP and everything like that to power the organ. So that means because your brain uses so much energy, it needs a lot of energy to function. Also needs hydration. Make sure you drink your water. What you eat has a direct impact on your cognition levels. And when I say cognition, I mean thinking. I mean processing things mentally. Okay, it's not just memory or anything like that. It's all of it. So cognition is like thinking and processing. So roughly speaking, your brain is not fully developed until about 25, sometimes a little bit later. There's still, most people say 25, but I wonder if it's closer to 28 in some people. That's just me personally, just from my own anecdotes and observations. That does not mean you have free reign as a teenager to just act like an idiot because my brain isn't developed. No. Okay, you're still growing into an adult. You still have to take some responsibility for your actions. Sorry. That being said, specifically as your brain's developing, so you're going through two major areas of brain development in your life. The first one is when you're like early childhood, toddlerish age. If you ever met a toddler, you know they touch everything, they stick everything in their mouth, they ask who, what, where, when, and why 5,000 times a day. It's very exhausting when you're on toddlers. And that's because their brain is making all of those connections. Remember, we talked about neurons and those signals being sent from one neuron to the next, and we're building that web. We want a nice, dense web of neurons to make your brain tissue. Okay, so that's what's happening as when you're a toddler, early childhood age. Okay, that's why like fine motor skills take time to develop as you're writing with a pencil and things like that. That's why they have those things in school to help kids learn those. That's why they give them blocks and things to build with, because they're building skills that build neurons. Okay. Also, the second time your brain goes through a major upheaval in terms of development is your teenage years. So you're not completely insane. You're not completely crazy if you feel this wonky as a teenager. I don't miss those days. It's because your brain is literally restructuring itself. It is trying to figure out what is important, what is not, based on life experiences up to that point, what we think is going to be important. And it's completely overhauling things and getting rid of stuff we don't need, making new connections, etc. So take from that, it's a great time to continue to build your cognition levels, build your connections and things like that. That's why I want to challenge you to learn all these cool things in my class and the other classes, because you're actually helping your future brain. So again, your brain is still developing. So yes, you will make dumb decisions. Is that 100% excuse? Like, no, you can't use it in your court of law. Sorry. But it is an explanation. Okay. No human is perfect. God love teenagers. Sometimes y'all do weird things. All right. And part of it is your brain and some of it's just not thinking. Because your impulse control can be kind of wonky as a teenager as well because of this, especially your frontal lobe as a teenager. That area right up in front behind your forehead. That is what's, remember we talked about, that's responsible for decision making, impulse control, higher level thinking, all of that stuff that seems pretty important to being a calm, cool, collected adult. Yeah, that's it. That's in chaos mode as a teenager. That's why you have friends, or maybe yourself, maybe it's you, I won't judge, who just like does the stupid thing first and then thinks about it later, and then you're like, oh, should have done that. So if as your brain is developing, something disrupts the process, whether it's something from the environment, such as a substance you may consume that you're not supposed to consume, or dietary things, or injury, an illness, disease, anything like that, that can cause the progression or the eventual for final development of the brain to be delayed, off track, something, and it will affect your adult brain. This is why, like in the 80s and 90s, they were always yelling at us, be like, this is your brain on drugs. And they would show like an egg in a skillet frying. Was it a bit dramatic? Yes. Yes, it was. But it got the point across. Okay, your brain is literally developing. Take care of it. And one of the ways you take care of it is you need to sleep. Go to sleep at a normal hour. And my normal hour did not mean 3 a.m. Okay, y'all are in school at 8 a.m. 5 hours is not enough for a teenage brain. Not even close. It's not even enough for an adult brain. My God. Go to sleep at a normal, good hour. You need at least 8 hours, maybe even 9 or 10, depending on what else you got going on in life. Eat as balanced of a diet as you can. Make sure you're hydrated and actually take care of yourself, because that's going to affect literally your future brain. I'm sorry if you hear the dogs rustling in the background. They're jealous of my hat. Okay. So why do we study conditions of the brain? Why should we care? All right. So fundamentally, we are people. We want to treat other people like as people, because that's the whole point of this crazy thing called life. But also understanding how the brain develops and where it's developing and why, and what triggers what. It's like a big piece of fuzz. Okay. That's all critical to understanding why we behave the way we do, why abnormalities occur, and how they're occurring, as well as understanding how the body and the brain communicate back and forth through that nervous system, through all the peripheral nerves and things like that we talked about. If a person experiences a change in their mental health, that can impact their behavior, how they view the world. It is going to impact how they process environmental information. It's going to affect literally their entire life. It's not a small thing. If there's a neurological condition present, that's going to affect also their quality of life, again, sensory interpretation, how they're understanding the world around them, and a whole bunch of other factors in their health. So we also want to think about, we study these because of awareness. Much as I hate social media, and we'll get into that with how it relates to your brain. One of the good things about social media is it can be a really great way to bring about awareness to certain things in the world, such as depression or other mental health concerns. I do like that, because, and then we bring more awareness to it, there is less stigmas around the condition itself. Like people did not used to want to go get treatment for depression because it was shameful, it was embarrassing, what have you. But if it's more easy to talk about going to therapy or being on medications for your mental health or something like that, it's much easier for people to be like, hey, you know what? They're doing okay. You know, I know somebody who gets mental health help and they're okay. I should go get some help too. All right. And then, of course, we can get this leads to more funding for research for treatments because we'll talk about some conditions and diseases they don't have cures. Even in the year 2026, they don't have cures. And I know people will talk about that are suffering from some of those conditions, and they are not fun. And of course, this also leads to further increase in rates and diagnoses and things like that. So overall, it can be very beneficial. Okay, so fundamentally, we need to talk about the difference between mental health disorder or a neurological disorder. Okay, so let's look at neurological disorder first. So it is the damage or alteration to the nervous system, which impacts its function. Now, these alterations or factors can come from birth defects, injuries, infection, chronic disease, and acute disease, your diet, things like that. There are different treatments for these, like medication, different types of rehab, like speech therapy, occupational therapy, physical therapy, psychotherapy, etc. And when I say therapy just by itself like this, that usually means like psychotherapy, like talk therapy, like CBT usually is a very popular method. Then we compare it to mental health disorders. Okay. This is a disturbance of a person's thinking. Again, thinking means cognition. Cognition means thinking. I'm going to use the word cognition a few times today. It's also a disturbance to their emotional regulation and or their behavior. This is a little bit old of a statistic. It says 1 in 8 people have some variation of a mental health concern. Honestly, that's from pre-pandemic. I feel like it's higher now. When it comes to different mental health concerns, anxiety and depressive episodes are very high. Your mental health can be influenced by a whole lot of internal factors. That's going to be your diet, which you can't work on. That's something you can control to a point. Your genetics, you can't control your genetics. Sorry about it. Your neurotransmitter levels, those are heavily based off genetics and your diet, and also medications and things like that. So they're the middle ground. You can kind of control your neurotransmitters, but only so much. And we'll talk about external factors that also impact, such as your socioeconomic status, how stressed you are, have you gone through a triggering event recently, things of that nature. Tut, leave your sister alone. Yeah, you. Okay, neurotransmitters. Turn to page 2. So I've mentioned this before, but just so we're clear moving forward, the neurotransmitter is essentially a chemical messenger. Okay. Remember we talked about the impulse going from the soma or the cell body of a neuron all the way down the axon and out the synaptic terminals. It goes into the little space between between neurons called the synapse. This is that chemical messenger that's going between the molecules, like telephone. Okay. Essentially, they are molecules. And when we talk about these different neurotransmitters, you're going to see a molecular structure in the corner of the slide because these are molecules. Okay, we know what they look like, structurally what they look like. So these molecules, these chemical messengers, are there to cause a response either from another part of the nervous system or a whole different body system, because neurotransmitters also work on like your muscles, for example. So neurotransmitters, we're going to classify them into 2 major groups, either excitatory, which is going to cause a response, or inhibitory, which is going to stop or prevent a response. This is completely dependent on what target they are going to, what neurotransmitter we're talking about. So there are over 40 neurotransmitters that act on or respond to different parts of the brain. No, I'm not going to go over all 40 of them, dear God. Why would I do that to you? This is high school. Okay, but also I don't know about all 40 of them off the top of my head. I'd have to learn that too. That'd be fun. But we are going to talk about the big 5, basically, that you do need to know, and you've probably heard some of before. Is that 40 an end all be all number? No, there's probably more. They're still doing research. So neurotransmitters, because they are this chemical messenger, this molecule, how much there are and where they are is very, very critical as well. Okay. So if there is a deficit, meaning we are missing some neurotransmitter, we don't have enough, that can lead to slower responses. If there's a response at all, it can change how the brain is going to go to respond to different situations. Like if it's like, I know I don't have enough dopamine over here, now I got to figure something out. Or there can be an overabundance. So this is where the brain can get a little confused because there's too many responses going, there's too many signals firing. So that's actually going to cause the brain to kind of slow down and double check itself in a sense. And so it's going to lead to slower reaction times. And this can also cause some conditions we'll talk about. So kind of think about like the Goldilocks and the Three Bears. You don't want too little neurotransmitter, you don't want too much neurotransmitter, you want just the right amount of neurotransmitter. Okay, so the big five we're going to talk about: serotonin, glutamate, dopamine, GABA, and norepinephrine. All right, it's kind of hard to see that structure of my lovely face there, but when you should have your slides in front of you as well. So here's serotonin. Okay, again, I'm not going to make you memorize the structure of this. This is not organic chemistry in college. I'm not that mean. But this is serotonin. I'm sure you've heard of it. It's, again, I'm not a fan of social media, but it has been popping up on a lot of mental health type social media posts. So serotonin is both an excitatory and an inhibitory neurotransmitter. It really just depends on what receptor is being targeted. That's what its job is going to be, basically. So it's going to be produced by neurons in the brainstem, as well as in your GI tract and in your platelets, which are the little tiny, tiny, tiny cells in your blood that actually clot your blood. So serotonin, the reason it gets a lot of attention, for good reason, is it's there to help with the regulation of your mood, emotions, helps with your sleep and wake cycle, helps regulate your body temperature, helps with perceptions of pain. So like people who have some of these associated disorders like depression, they don't respond to pain the same way that somebody who's not depressed does. It's kind of interesting. As well as with depression, there's a generally, we'll talk about it, but there's this disparity in how much or how little they sleep and when they sleep. So then we have glutamate. So this is an excitatory neurotransmitter, specifically the central nervous system. Remember what CNS means. So it's going to be secreted by sensory neurons and the cerebral cortex. It is there because it's great for helping with learning and memory, and again, causing excitatory actions. So bringing about a response in the central nervous system. This is typically found in different cognitive disorders. So leave your sister alone. Cognitive disorders being disorders related to thinking and processing information, and epilepsy, which we'll talk about. Then we have dopamine. Again, I know you've heard of this one from social media, TikTok, Instagram, Reels, whatever. Again, like serotonin, it's also excitatory and an inhibitory neurotransmitter. Again, depending on what the job is, what's going on. It is produced by two locations in the midbrain, and it's similar to serotonin in the sense it's also helpful for mood regulation. It's also important for learning, attention, movement, etc. If you've heard of the reward system, this is the big one that plays a role in it. Okay, so when I say reward system, so we all know there are boring things in life. That's just part of life. I'm sorry. I can't fix it. But I guarantee you, most of you light up your brain's reward pathway every time you pick up that phone and start scrolling through TikTok or Instagram or whatever, because that's exactly how those phones are designed. They are designed, the people who design those apps and things like that, they purposely looked at the neuroscience of how dopamine works in the brain and how they can essentially influence you to have more or less dopamine based on how many likes you get on a video, things like that. It's kind of crazy. This same thing happens with gambling or other addictions. Same thing. Like for somebody who's a shopaholic, this pathway full of dopamine gets activated when they get to go shopping or when somebody gets to go gambling. Okay, this is the same thing, which is why addictions can be so hard to break, because your brain likes this dopamine being there in high amounts. It likes that pathway being lit up. It doesn't want you to go back to boring humdrum life. It says, no, gambling and shopping are fun. Keep doing that. Just like your social media app saying, yes, keep swiping all day. Leave your sister alone. So if you have low dopamine, This is going to lead to a lack of motivation. You're going to feel very tired. You might have some memory issues, mood swings, sleep concerns. And on the other side, we have high dopamine, which is going to be anxiety, insomnia, whole lot of energy. Again, mood swings because we're not stable. We're going back and forth, maybe. Hallucinations in some cases. So associated disorders we'll talk about, like Parkinson's, depression, anxiety, ADHD, addiction, and schizophrenia. Then we have norepinephrine. Come here, come here. You were getting on my last nerve today. So this is an excitatory neurotransmitter. Sometimes we just call it NE because norepinephrine is kind of a mouthful of a word. I will warn you, it looks very similar, especially get rid of the first few letters. Epinephrine is a different thing. Okay, if you've ever seen somebody use an EpiPen, that's epinephrine, that aka adrenaline, which is what is produced by your adrenal glands, with like the little hats on top of your kidneys. Okay, that is a separate molecule. This is norepinephrine. It is different. Okay, it is not produced by the adrenal glands. It is produced in your brainstem. Actually, it is produced in the adrenal glands, my bad. But primarily, the ones we're focusing on for this unit is going to be your brainstem and your hypothalamus. Okay, but norepinephrine and epinephrine, not the same molecule. Okay, so we're going to see this come into play with depression, anxiety, and again, your sleep-wake cycle. And then last but not least, we have GABA. Its full legal government name is gamma aminobutyric acid. You can see why they call it GABA. Much easier to say. It is an inhibitory neurotransmitter. It's produced by the spinal cord, your cerebellum, your basal ganglia, and several parts of the cerebral cortex. This is, again, another one tying into mood and emotion regulation. Low levels of GABA tend to lead to anxiety disorders. So you've probably noticed the past 5 slides, almost every single one of them has something to do with mood, regulation, behavior, something to that fit, because you're noticing there's a lot of overlap, hopefully. So this is part of why the brain is super complex, and also why if you do need to seek pharmaceutical interventions, such as an antidepressant or something like that for a mental health concern, this is why it can be so frustrating, not only as a provider, but also as a patient, because we don't just necessarily, the doctor can't just look at you in the clinic and be like, oh, yes, you need dopamine, not serotonin. Here you go. They don't know. So it's kind of a game of, well, I hope this works. Okay, no, it didn't work. Try this one. Oh, that didn't work. Try that one. And keep in mind, each time you try a new medication for these different conditions, it's like you have to be on it for a good 4 to 6, if not 8 weeks before you see any possible results. And so this gets very frustrating for patients because they're like, I want instant fix now because, you know, we're so used to instant gratification on these stupid phones. And that's not how it works. And it's very frustrating. And a lot of people kind of give up because they're like, well, it's not working. It's not working. And I get it. It sucks. But if you do need these kind of medications, work with your doctor as best as you can. I promise you they're trying to help you. All right, so let's talk about mental health disorders first. So this is the DSM-5. So they don't have a set publishing time, but basically this is a big 5th edition of this diagnostic manual that has come out. And this is the manual that is the best friend to psychiatrists and psychologists around the world. Basically, it is a whole big book of criteria of every different mental health or neurological disorder that could be and how to diagnose it, how to treat it, what the symptoms are, so on and so forth. So this one was published in 2013. There was a text revision, so it's called the DSM-5 TR in 2022. You don't need to know that for your notes or anything. Just know it does occasionally get updated. I feel like when I was in high school taking psychology and learning about it, it was like the DSM-4 was what I studied. So, whee! All right. So let's look at this. So first up, we're going to talk about depression. So the full name, as it is in the DSM-5 today, is called Major Depressive Disorder, MDD. It used to be called unipolar depression because we'll talk about bipolar, bi meaning 2, uni meaning 1. So it used to be called unipolar depression because the person who was afflicted with this was only depressed. Okay, so it is definitely a mood disorder. All right, the highlights, if you will, of its just characterizations are going to be sadness, hopelessness, and loss of interest. And these are persistent feelings of this. This is not just a, well, I'm having a bad day and I'm sad. You can be sad. You can have bad days. That doesn't mean you are depressed. Okay, that's one thing I don't like on seeing social media is people get on to be like, oh, I had such a bad day. I'm so depressed. No, you're not. You're having a bad day. That's perfectly fine. Have a bad day. Cry, yell, scream. I don't care. But you're not depressed. Depression has to be diagnosed, as do all these conditions we'll talk about, has to be diagnosed by a medical professional. Okay. And even if you go to med school one day, if you want to and you want to, I'm here for it. You can do that. You cannot diagnose yourself. Okay, that's not ethical. Anyway, so if you have a bad day, that's one thing. If you have these persistent feelings of sadness, if you are withdrawing from your friends or your family, if you are very irritable, if you cannot sleep, or on the flip side, for some folks, you sleep all the time. Like literally nothing will get you out of your bed. If you have a sudden change in your appetite, meaning you either start eating everything in sight or you stop eating at all. If you feel misunderstood, which immediately as a teenager, yeah, that's kind of it. That's kind of a teenager symptom, isn't it? There could be some anxiety with this. You could have some slower cognition levels. You might have trouble concentrating. You might have some anger things going on. And one of the dead giveaways is you suddenly lose interest in your normal hobbies. So whatever your hobbies were before these symptoms onset and became persistent, maybe it was drawing comic books, maybe it was playing basketball, something like that. If that interest is no longer there, something is wrong. Okay. So for treatments, we've got medication. There's a whole bunch of different antidepressants out there, different categories to them. I won't get into it in this class because that's literally an entire class by itself. There's psychotherapy, which is like talk therapy, again, CBT, things like that. You can do lifestyle changes, like maybe you're having trouble getting out of bed, so you get one of those alarm clocks with wheels on them. And if you hit snooze, it rolls away from you. Ask me how I know those are annoying. My mom, I know I bought myself one in college, and it lasted one day. Because I did not like that thing. Anyhow, areas of the brain. It's going to be your hippocampus. That's where your memory comes into play. Your prefrontal cortex, decision making, all that stuff. Your amygdala, that's your anxiety and fear center. And your thalamus. So you see how all these areas we talked about and what they do? Seeing why they're kind of important now? Yeah. There we go. Okay, and then we have anxiety disorders. So the term anxiety by itself, a lot of us probably picture something like fear or trembling or terror, something like that. I mean, heck, if you saw Inside Out 2, okay, a little orange girl. But anxiety disorders, so it's a very broad category of different disorders because there are, again, in science, we kind of categorize things, right? So for anxiety disorders, we're talking about a frequent, intense, excessive, persistent, like a nagging, won't go away, it's interfering with your life kind of worry about everyday things. And there's different types of anxiety out there. So like there's separation anxiety, there's different phobias. You could be, scared of different things. There's social anxiety, such as, wanting to avoid social situations, parties, friends, etc., because for something, says, no, that's not right in your brain, right? And then we have generalized anxiety disorder, okay? I will tell you with a lot of these disorders, they can be what we call comorbid, meaning they can be coexist with another one. So like anxiety and depression, they tend to overlap a lot. So a lot of times if your provider is still like working on some medications and, therapies and stuff with you, you may get diagnosed with both. It's not a bad thing. It's just a fact. It's okay. I'm trying to help you. So the key here is the anxiety itself as an emotion is a normal part of life. Think about it from a survival ancient human aspect, way back in time. Okay, anxiety was a survival instinct. It kept you alive. Okay, it was a little nagging voice in the back of your head saying, that doesn't look safe over there in that tall grass. Maybe there's a predator in there. We shouldn't go there. Okay, obviously it's not a huge concern in the modern day, but anxiety or shows you are aware of, it's a way to be aware of your surroundings, because you can still get hurt, you can still do dumb things in the modern world. Just because there's not saber-toothed tigers trying to kill us everywhere, there's still ways to get injured and so on in the modern world. So anxiety, that little voice in the head, back of your head saying don't do that, that's a normal thing. Anxiety disorders come in when that little voice becomes so loud you become paralyzed, or it's an overwhelming fear, like it is interfering with your daily life, it is interfering with your ability to function. That is an anxiety disorder. Okay, so symptoms are going to include things like increased breathing rate, a rapid pulse, sweating, trembling, dizziness, an overwhelming sense of panic. You might have trouble concentrating. Well, if you're terrified of whatever is around you, yeah, you're probably not going to be concentrating on your math homework. Okay, you might have trouble sleeping. Again, excessive worrying and related GI issues, meaning gastrointestinal tract, your digestive system. There's different medications out there. Again, they may be very similar, if not the same ones as your depressive medications. That's fine. Okay. There's different psychotherapies. Again, that's going to be more adapted to the type of anxiety disorder you specifically have, because somebody with social anxiety is not going to benefit as much from, exposure therapy to a phobia, because it's a different thing. Okay. Areas of the brain, again, hippocampus, amygdala. Amygdala definitely involved here. Your hypothalamus and your thalamus. And what they have noticed, so we can take scans of the brain. We can see like density and activity levels. That's what these little wonderful, colorful images are. And we can have noticed in some patients, if the anxiety disorder is prolonged, there may be some structural degeneration, like things might start to break down. So that's why we got to keep researching this more and understanding better ways to treat it. When you get a chance, here's a little infographic I found online. Check it out. All right, bipolar disorder. So that is the name it goes by today. Remember how depression used to be called unipolar depression? Now we have, because on the flip side, this used to be called manic depression. So bipolar used to be called manic depression. Nowadays, it's called bipolar disorder. So this is a lifelong condition. When I say lifelong, the word we're going to start using is chronic. So chronic is something that persists for a very, very, very long time, whereas an acute condition, ACUTE, acute, is more of a sudden onset, and it usually can have a resolution. Okay. So for bipolar, we're looking at extreme mood swings, and that the reason it gets this name of bi, meaning two, is because that you go from very, very, very highs in terms of emotions, like mania, like really, really excited, to very, 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 very low depressions. Okay. When a person is in this state, there's not a lot of middle ground. So because of these extreme mood swings, their judgment is affected, their behavior is affected, their cognition, how they reason, their energy levels, how much they're sleeping or not sleeping, and their concentration is all affected. So you see how this is going to affect their daily life a lot. Now, this isn't a constant thing. So not chronic means long lasting. Constant would be just like no stopping. Okay, so they tend to get, it depends on their medications, their age, their other health, and so on and so forth. But in general, the mood swings are just a few times a year, and they last for a few days to a few weeks, kind of, again, person dependent, medication dependent, etc. And in between, you wouldn't know that they have this, like they're normal people. I mean, they're people either way. So it's just like maybe they didn't pick up their medication at the pharmacy in time and they missed a day or two, and that can offset some of the neurotransmitter balances. Like stuff happens. Okay. If they're in a mania, they're going to have a euphoric mood. They're going to be very excitable, high energy, but they're also going to be very irritable. Okay, like they don't want to be put off from whatever the heck they're doing at that time because they have a great idea. They're going to do it right now. You're not going to bother them. Okay. And then, of course, their depressive symptoms would be similar to unipolar depression. And for medications, we've got psychotherapy. They've got different lifestyle changes. There's different ways to have this disorder and be a productive, perfectly normal member of society. He's judging me. Okay, next up is PTSD. Its full government name is post-traumatic stress disorder. This is probably another one you may have heard of. This is something that is kind of like more of an acute, but then can turn into a chronic situation, depending on treatments and things like that. So, I don't know you, potential spam. Go away. When this happens, it's usually after a person witnesses or experiences some sort of trauma. Okay, this is very common in war veterans, people who have seen things that we can't even imagine. Okay, so their symptoms, because they may be reliving this traumatic event, so they may have nightmares, they may have flashbacks both in the nightmares as well as during the day. If they see something very similar to, maybe they see a familiar face that was like part of their trauma event, something like that, something that causes it to just come rushing back to them. They may have difficulty concentrating. They may avoid certain people, places, or things that remind them of the trauma. They can feel very detached and numb. They can have lots of intrusive thoughts. They can have a very sudden change in their sleep patterns. Again, either too much or not enough. Again, stress, like we've talked about before, is a normal part of life. It's a survival thing. Okay, it's make sure you are keeping up with the environmental stressors and things like that are going on. So stress itself, especially after trauma, that's normal. It's normal to have heightened levels of stress after a trauma. What's different about PTSD is the stress and the reactions and all the symptoms are persistent. They don't go away for at least a month or more. And again, they're then taking over the person's daily life. The person cannot function. That is the characteristic of a lot of these different disorders, is it inhibits the person's ability to function normally in daily life. So we've got treatments, again, such as like medications like antidepressants. There might be some more psychotherapy, social group, social support, maybe some lifestyle changes. Kind of depends on the situation. Amygdala is involved, your hippocampus, and your prefrontal cortex. So I can see how there's a lot of overlap here. I wonder why that is. All right, then we have obsessive compulsive disorder, aka OCD. This is one that really gets misnamed and not used correctly on social media, and it really irritates me. Just because somebody likes something neat, okay, or they like things done a certain way, like in terms of cleanliness or whatever, that's not OCD. Okay, don't say that. Again, these conditions are characterized by overwhelming feelings, in this case, intrusive thoughts, which are the obsessions, and the repetitive actions because of those intrusive thoughts. Okay, so it's not just, double check your door at night to make sure it's locked. It's, I got to check that lock 25 times. I got to wash my hands 25 times to the point they're raw. Okay, this is not a normal response to a stressor. Okay, if somebody just likes things nice and neat, that's fine. Let them be. Okay, this is different. So again, these things interfere with a person's daily life. They can be very time consuming, because think about it. If somebody truly is OCD and like needs to repeatedly wash their hands for their intrusive thoughts, that's their compulsion. Think about how much time it takes to wash your hands that many times, because they're not just quickly running some water over their hands and like, okay, I'm done. Like I know half of you do in the bathroom. Use soap. I'm judging you. Okay, gross. Also, stop going in the bathroom and hiding. It's gross. Anywho, that's a lot of time to wash your hands correctly. It literally takes over their life. Typically, with others, you're going to use a combination of medications, psychotherapy, etc. This is specifically going to target their frontal cortex, your amygdala, your thalamus, your cerebellum, places like that. Okay, next up is autism spectrum disorder. Okay, this one again is pretty popular, especially right now on social media. Do not diagnose yourself as autistic because you saw TikTok. I will judge you for that. Okay, so this is a developmental condition. It is complex. It is chronic. So remember, chronic means long lifetime. Okay, And again, it's also often comorbid, meaning it exists with other conditions. Particularly, it seems to be like its bestie is ADHD and depression and things like that, which can make for a super fun mental health combobulation up here. So you'll notice the whole name has the word spectrum in it. Spectrum meaning there is a span of differences. Okay. So every single person with autism spectrum disorder is not going to look exactly like the person across the street who has autism spectrum disorder. They can have different symptoms, different levels of this disorder. Okay. So don't judge one person based on another person, basically. We shouldn't do that anyway, but especially for things like this. Okay. So there can be challenges related to social communication. People with this condition often have very restricted or very specific interests. They may do repetitive behaviors, such kind of like OCD. Of course, one of the reasons it's so popular on social media, especially lately, is because of everyone's arguing over where autism comes from. Because autism does have a very negative stigma around it. Because you just think about it, a lot of times in the olden days, and I say this like I'm not old, but those who were autistic and displayed different behaviors socially were considered weird. We didn't want to associate with the weird people. Well, the kicker of it is autism's genetic. So by admitting that you're related to the quote weird person, that's awkward. We don't want to do that, right? So they're always looking to pin the blame on someone else. Well, back in, I think it was the 80s, maybe early 90s, can't remember. There was this doctor who came out with this paper and he said that vaccines cause autism. No, they don't. Okay, he lied. He lied. He used false data. And for some reason, that paper has hung on for so long, even though it has been repeatedly disproven. Okay, multiple other researchers across different disciplines have challenged it and found he was very, very, very wrong. Okay, and he was so wrong about it, they literally revoked his medical license. He can't practice as a medical doctor anymore. Okay, so I don't want to hear that vaccines cause autism, because they don't. What does cause autism? Genetics, certain environmental factors. I won't get into the epigenetics of it all, but basically you have switches, so to speak, in your code of your genetics, and certain environmental things can flip them on and off like a light switch. I won't get into that. But genetic is a huge factor. Okay. And also, autism was not diagnosed the way it is today, like way back in the day. Okay. So that's part of why there are higher rates, is we have a better way of diagnosing it. We have a better understanding of it. Okay, for treatments, again, it's going to vary person to person, where they're at on that spectrum, what supports do they need. Okay, so there's behavioral therapy. There's different, if they need more like life skills kind of side of the spectrum, so they can be more independent, they might need occupational therapy that helps them with everything, like, being a functional adult, things like that. They might need speech or language therapy depending on how their vocab and things have come in. They might need some social skills support. They might need different medications. Just kind of varies person to person. Areas of the brain: cerebellum, hippocampus, frontal lobe, temporal lobe, amygdala, parietal. Okay, in this picture specifically, this is the social reward pathway. So dopamine is going to be involved here. You'll notice it's much reduced in an autism patient, because social situations are difficult for a lot of them. They don't have that same social drive as a non-autistic person, neurotypical, if you will. Okay, then we have ADHD/ADD. Okay, so the full name is attention deficit hyperactivity disorder. A lot of times people use ADD and ADHD interchangeably, but your official diagnosis will say ADHD. And what's interesting is, because males and females present so differently with this condition, males tend to get diagnosed as children, because they take the hyperactivity part, and it's a physical hyperactivity. Like, they're the ones who can't sit still in their chair. They're doing this number the whole time, right? Every teacher's like, oh no, Because I'm like, how do I just stay in the chair? Okay. Females, the hyperactivity is up here. And that is much easier to conceal on the outside. Not saying it's just as they're both difficult to live with. You have to adapt for both, but girls tend to get diagnosed much later in life because no one notices their hyperactivity because it's internal. So when you have this condition, it actually affects your brain development and how your brain functions. That's huge. It is a chronic condition. It is not just a take this pill for 10 days and it'll go away kind of thing. It is a lifelong thing, man. Okay. That's why there are different types of treatments and supports. Again, person to person is going to vary slightly. We can work on behavioral changes. The person can go to psychotherapy. They can take different medications, such as like stimulants, which help calm some of that hyperactivity down, ironically. So like somebody with ADHD, like caffeine is a stimulant. Caffeine barely works on someone with ADHD because their brain is just like, oh, this is good now. We're good. Whereas somebody who's a neurotypical, when they have caffeine, they're suddenly bouncing off the walls. So symptoms, inattention, impulsivity, hyperactivity. Again, that's either mental or physical or both, depending on the person. This person might have difficulty with organization, might have difficulty with time management, like time just slips away and they have no idea what happened. Okay. They might have trouble regulating their emotions, which means sometimes they can be very irritable or very quick to anger. Okay. Like, especially if they're like really focused on something they're doing at the time and you come in like, hey, we need to move on or whatever, they can be very irritable when you do that. They may have some social challenges involved because of like some of the other things like, hyperactivity, being irritable, etc. They definitely have trouble completing tasks. Okay, if there is no dopamine, that reward pathway involved, they don't want to do it. You can't make them. There is not a force in the world that says, hey, go do the thing. And there's like, no. Until they get that dopamine, which is where the medication can come in and help kind of regulate that and smooth out the bumps, so to speak. There may be some memory issues as well, especially as they get older. A lot of ADHD people, because the cerebellum is involved, they're very clumsy. They have balance and coordination issues. They're always bumping into things. Okay, so we've got different, again, areas involved. Check those out. Again, hippocampus, memory, cerebellum, balance, frontal cortex. That's all the higher level thinking. Exactly what it affects. Kind of crazy. Okay, then we have schizophrenia. So again, it's chronic. It is specifically a psychiatric disorder that is characterized by a disconnection from reality. So when I say that, it means we're going to have symptoms like delusions. They're going to have trouble thinking. They're going to have trouble with their memory. They're going to have a lot of negative social behaviors that can come out because of these different delusions and ways of thinking. Their behavior is usually not predictable and or sometimes may not be socially acceptable. Again, person to person varies. And what you're noticing on this picture here, so you have ventricles in your brain, which are essentially like gaps where the cerebral spinal fluid is made and hangs out. You want that. You'll notice the gaps here are much larger. It's interesting. So if you have that much of a ventricle space versus this, you'll notice that's probably going to cause some issues. There is a strong genetic component to this, as well as environmental factors, which the environmental factors can then also make the condition worse or better. So there's, again, different medications, social supports, psychotherapy, all that. We're talking about the frontal lobe, the temporal lobe, the hippocampus, because that's your memory, and all of those other areas. And then we also have eating disorders. Okay, so it was hard for me to only do one quick slide about eating disorders because again, if you look down here, there's a ton of eating disorders. Okay, and they're all different, all have different diagnostic criteria. They all have different symptoms. So this is by no means an end here. Okay, and again, they can be comorbid with like depression and things like that. So essentially, when we're talking about eating disorders as an umbrella category, we're talking about the disordered view around food and a person's body image. Okay. They're going to view their own body differently. They're going to view food a lot of times in a very negative way. So symptoms are going to be, on one end, they can have very restrictive eating. On the other end, they can binge eat, which means they eat like all the things. And usually that's followed by a purge where they throw it back up. And that's a forced purge. It doesn't just happen naturally. It's not like when you get the flu and the body's like, get it all out. No, they're forcing it. They're going to do sometimes compulsive exercise. Because of these thoughts and actions around eating, that means they tend to withdraw socially. They're going to have trouble sleeping. There's also these physiological things are also going to happen in terms of, like, they're going to have hair loss. They could have GI issues. They could have dental issues, because if you're constantly forcing yourself to purge, stomach acid is constantly hitting your teeth. They're going to rot. Okay. They could have anemia. That's low iron in their blood because you're not getting enough nutrition. That's also why your hair is going to fall out. You can have a low pulse rate. There's a whole lot of other things that can come about from this. Okay. Your amygdala is affected, as well as your frontal cortex. Depending on the severity of the eating disorder, there may need to be immediate hospitalization involved. Just depends person to person. And then once we get them onto, like, one of the things they work on in the hospital will be like behavioral therapy, psychotherapy, work on nutrition, so they can kind of reshape their ideas around food, both with the therapy side as well as the educational side. Things like that. So different just eating disorders that exist. There's anorexia nervosa. I can't speak today. There's bulimia nervosa. There's pico, which is where you're eating things that are probably shouldn't be eating, like dirt, but their body inherently wants them to eat that. There's rumination. So ruminations where you're just constantly thinking, overthinking, constantly heavily focused on something. Okay. And then there's binge eating disorder. Okay, and we'll talk about neurological disorders in the next video, because I feel like this is already getting super long. So, to be continued. How do I stop?